What is the primary role of the intra-aortic balloon pump, ABCP, during the weaning process from CPB? A. To increase myocardial oxygen consumption. B. To assist in oxygenating the blood. C. To reduce afterload and improve coronary perfusion. D. To support pulmonary circulation. Answer: C. To reduce afterload and improve coronary perfusion. Explanation: the intra-aortic balloon pump, ABCP, reduces afterload and enhances coronary perfusion, especially in patients with left ventricular dysfunction. This support is critical during weaning when the heart is trying to resume normal function independently of CPB. Which of the following conditions would most likely lead to a prolonged weaning process from CPB? A. Hypovolemia. B. Myocardial ischemia. C. Acute renal failure. D. Hyperglycemia. Answer: B. Myocardial ischemia. Explanation: myocardial ischemia is a major contributor to a prolonged weaning process from CPB. It can prevent the heart from resuming normal function due to inadequate oxygenation and perfusion. Reperfusion therapy and support may be needed to address this issue. During the weaning process from CPB, what is the primary reason for monitoring urine output? A. To assess renal perfusion and function. B. To monitor for electrolyte disturbances. C. To guide fluid administration. D. To assess the effectiveness of diuretic therapy. Answer: A. To assess renal perfusion and function. Explanation: monitoring urine output is essential during weaning from CPB to assess renal perfusion. Poor urine output may indicate inadequate renal blood flow due to low cardiac output or hypotension, which may require further interventions to improve hemodynamics. What is the most common pharmacological treatment for hypotension that occurs during weaning from CPB? A. Beta blockers. B. Vasopressors. C. Calcium channel blockers. D. Anticoagulants. Answer: B. Vasopressors. Explanation: vasopressors are commonly used to treat hypotension during the weaning process from CPB. These medications constrict blood vessels and increase blood pressure, improving tissue perfusion until the heart can maintain adequate circulation on its own. What is the purpose of using heparin during the early stages of weaning from CPB? A. To prevent thrombosis in the CPB circuit. B. To facilitate hemodilution. C. To support myocardial function. D. To enhance cardiac contractility. Answer: A. To prevent thrombosis in the CPB circuit. Explanation: heparin is used during the early stages of CPB to prevent thrombosis and clot formation within the CPB circuit. Once weaning begins, heparin levels are typically reversed to minimize the risk of bleeding when transitioning to independent circulation. In patients with severe right ventricular dysfunction, which of the following devices is most commonly used to assist in weaning from CPB? A. Intra-aortic balloon pump, ABCP. B. Left ventricular assist device, LVAD. C. Right ventricular assist device, RVAD. D. Extracorporeal membrane oxygenation, ECMO. Answer: C. Right ventricular assist device, RVAD. Explanation: in patients with severe right ventricular dysfunction, the right ventricular assist device, RVAD, is used to provide support to the right ventricle, helping to maintain adequate pulmonary circulation during the weaning process. Which of the following parameters is most useful in determining whether inotropic support is needed during weaning from CPB? A. Pulmonary capillary wedge pressure, PCWP. B. Mixed venous oxygen saturation, SVO2. C. Central venous pressure, CVP. D. Mean arterial pressure, MAP. Answer: B. Mixed venous oxygen saturation, SVO2. Explanation: mixed venous oxygen saturation, SVO2, is a crucial parameter to assess whether inotropic support is needed. Low SVO2 levels indicate that tissues are not receiving sufficient oxygen, often due to inadequate cardiac output, which can be improved with inotropic support. What is the most common cause of failure to wean from CPB in patients undergoing valve replacement surgery? A. Left ventricular failure. B. Severe arrhythmias. C. Coronary artery disease. D. Pulmonary edema. Answer: A. Left ventricular failure. Explanation: left ventricular failure is a common cause of difficulty in weaning from CPB in valve replacement surgeries. If the left ventricle cannot effectively pump blood after valve repair, the patient may require additional support or a longer weaning process. What is the most likely cause of arrhythmias occurring during the weaning phase from CPB? A. Hypokalemia. B. Rapid cooling of the heart. C. Myocardial ischemia. D. Excessive use of anticoagulation. Answer: C. Myocardial ischemia. Explanation: myocardial ischemia during the weaning phase can lead to arrhythmias, as the heart may not have adequate oxygen supply. This is especially common in patients with coronary artery disease or those who have experienced prolonged periods of low blood flow during surgery. What is the purpose of weaning off CPB in stages, rather than abruptly? A. To reduce myocardial oxygen demand. B. To allow for gradual recovery of the heart's function. C. To assess coagulation status. D. To avoid fluid overload. Answer: B. To allow for gradual recovery of the heart's function. Explanation: weaning off CPB in stages allows the heart to gradually resume its function and handle the increased workload. This stepwise approach reduces the risk of sudden hemodynamic instability and provides a more controlled transition to independent cardiac function.